everyone. You're watching We Heart Therapy. Today, we're going to talk about sexuality and highly escalated couples in stage 1 of EFT. And we have a very exciting guest today. Her name is Zoya Simakhodskaya. She's one of our trainers from New York City, and she's agreed to join us today and talk to us about her specialization in her specific workshop around working with sexuality in emotionally focused therapy. Thank you so much for joining us, Zoya.
You're welcome. My pleasure. This is such a great idea to have a little chat that can be available to everyone.
Great. So for those of our viewers who aren't familiar with who you are, who haven't been able to go to New York and attend one of your amazing workshops or see you work, can you talk to our viewers about how you came to be in the EFT community and a trainer and about the work you do? Because I know you go overseas as well and teach.
That's right. That's right. My EFT journey was probably similar to many other people. I actually was trained very psychodynamically, but I was always interested in couples and families and tried to learn systemic, structural couples communications. And what I would find is that I would read articles or attend workshop, and it would all make sense as I read it, and then I get into the room with a couple, and it all goes out of the window. And then completely accidentally, I attended a big conference on trauma and attachment, and Sue was one of the keynotes, and the light bulb went off. I said that I want to be able to do that, and I went to pursue the training and supervision, and it spoke not only to me personally. I changed my marriage, my personal life, but also completely changed how I work with couples, with individuals, with families. So I'm internally grateful to Sue and so thrilled that I found it. And the other piece was that for many years I worked in a psychiatric emergency room program at Bellevue Hospital, which I think even people in other places will know. And yeah, in New York City, and for 7 years I worked with people in psychiatric emergencies in the crisis clinic, and one of the things that I find is that working in an emergency room setting and working with couples is a little bit similar. You have to be on your toes, and you have to be prepared to deal with the big emotion and big affect, or no emotion and no affect, and to be able to connect to someone very quickly, to be able to respond. So the same attachment principle, the same Rogerian principles apply anywhere. And that was also my opportunity to teach and train many clinicians, so I'm quite passionate about that, which then brought me to become a trainer for Russia. So I've been going there twice a year, also Italy and Romania, so I'm really enjoying that.
So EFT is not only in the United States, and I know some of our viewers who are familiar with EFT know that it's in the UK, but we've also expanded it. I know we've had externships in Italy, as you mentioned, Romania, Russia.
Everywhere. There's so many countries. Holland, Simona Urban in Romania, Belgium, Germany, everywhere. I mean, it's really South Africa, New Zealand, Hungary. It's Greece. I have to stop because we'll take all the time. Yeah.
But that's really exciting because it really speaks to how emotionally focused therapy can cover a diverse group of folks. It's not, industrialized nations. It identifies that core attachment need is a fundamental, universal human need that we
That's right. That's right. It may have different emotions, may have different expressions, and there are different cultural nuances, but that universal attachment, longing to connect and be cared for is everywhere.
All cultures.
That's right.
So you have a specialization in sexuality, and how did you come to, focus in that area?
Well, it was a kind of combination of two things. One, for a few years, I was doing clinical supervision, couples EFT supervision for a group of clinicians working for Medical Center for Female Sexuality. So what I found, I didn't know a lot, and they were teaching me some, but over and over again, they would come in and they would say, okay, we have these women and we have couples who quickly respond to our interventions, whether behavioral or physical therapy, if women suffer from vaginismus or other disorders, and they would respond very quickly and the treatment would be successful. And then there were other couples and women who would not improve and they would be stuck. And that's where I found EFT was enormously helpful. So that was my first kind of learning about sexuality concern. And then, of course, as I began to learn and be more comfortable talking to couples about sex, suddenly all the couples began talking to me about their sexual lives or difficulties. And I decided I can't work with couples without having more knowledge. So I began to learn. I began to bring in speakers with different specialties. And because I realized so many of my supervisees and other EFT clinicians were saying, it's coming up, but I don't know what to do. And so then I'm afraid to ask, because if I ask, I have to do something with it. And do I need to refer people to sex therapists? And over time, I learned, I really believe that many of our couples that have sexual concerns would be helped by us. And there are subgroups that may need extra help where there's considering dysfunction and concerns. But we in EFT have a model, have an approach that can definitely address some of the couples that we see that present with sexual problems.
Right. So it sounds like from your work in the various areas that you've been able to work at, some of the locations, you've learned a lot about sexuality and couples. And I like how you said, that you found that quite a few couples were stuck and the other approach just didn't quite help them. So what else have you learned specifically around sexuality and sexual issues through your work with couples?
There's so much. Sexuality, the one big thing I learned, how complex it is. And it does require some extra knowledge about human sexual response, bodies, and nuances that will help us do a better job, to do a thorough assessment and make decisions that are what is more appropriate for the couple at what point. But one of the things that I learned is that when the couple is presenting very early on with sexuality, lack of sex, discrepancy in desire, couples who come in and say, we stopped having sex 2, 3, 5, 10 years ago, right? It's a long time. And typically, as we know, they have a negative pattern around it. And one person is very upset, very desperate, is, bringing it up either all the time or internally really feeling resentful, and it comes out in other ways. And the other partner is sort of so fed up with this and is avoiding and doesn't want to have a conversation, and even a small touch that might be just the partner seeking affection will raise an alarm that, what does this mean? Is he gonna want to have sex? Is she gonna want to have sex? Right? And they present with very rigid patterns. And they, again, similar to some other concern, but maybe even more, they begin to talk about in life and death terms, you know, using words like I'm starving, I'm deprived, and there's such intensity behind it. Intensity that I think often affects the therapist, who suddenly hears this alarm and crisis and feels like I have to give them something. I have to give an exercise. I have to give some homework. Tell me what, you know, what can I give them? And what we learn is that unless we help them de-escalate in this relational negative cycle, how they communicate about it, they will not be able, most of the time, to use any of the strategies or behavioral exercises. So that was one big thing that I learned. And also, I think, and this is something, you know, most EFT therapists, I think, know how to do. The piece that's, I think is important is there are certain knowledge about sexual response and sexual desire. You know, for example, you know, there's all the research on responsive versus spontaneous desire, or what kind of model of sexuality this couple or each individual has in their mind will affect how they are relating to each other. And it is my job to provide some psychoeducation and to be knowledgeable about that, so I can begin to kind of at least put a mirror up to these models that are outside of their awareness. Right. There are assumptions that people make, and they think this is just facts.
Right. A lot of people come in to our therapy room into their relationships with a lot of myths around sex and how sex should be and what it should look like.
Exactly. Right. Or even using the word sex, right? When people say, we don't have sex, I have no idea what they mean.
Right.
Do they mean intercourse? Do they mean other things? Is there a very specific rigid script that they're using? And so part of my job is understand the rigidity, where it's coming from, because it always comes from emotional deprivation or emotional distress. And they are not even often aware of it. You know, we had a couple, somebody presented in their, I think in their 70s, and the man was saying, you know, the Bible says you must have sex with me. So you can imagine that his wife and their therapist were not happy to hear that.
Right.
Right. So, but I want to be curious. I wanted to understand what would make someone say it's the Bible that says you must give me sex. That it came to a point in their relationship where he has to use that reason, because otherwise he doesn't know how to get through to his wife.
But that brings up a really good point, because I think a lot of therapists understand and see it quite often in their practice is the intersection between religion and sexuality, and a lot of times around the not talking about sexuality or sex, and in the therapy room when it's like, okay, so now it's time to talk about sex and how often you're having sex. Do you guys feel connected? And they're looking like the deer in the headlights. Like,
right.
Sex word.
That's right. And especially if you as a therapist also not so comfortable. There was a survey done. I don't have the name of the people who conducted the survey. That I don't remember who the therapists were, but what they found out, there was a group of people who had a lot of knowledge about sex, but actually were not that comfortable talking with their patients. And then there were a group of people who were quite comfortable talking about sex, but they didn't have a lot of knowledge. Right? So that is going to affect how we connect with patients. And so normalizing this important part of the relationship and giving permission to find words, because if they can't talk about it, And if they're having problems, it's never going to change, right? So respecting their values, and at the same time gently introducing, a way to have a conversation, because that most of the time people do feel that this is an important part of their relationship, because otherwise they would just be friends, they would be parental units, but the romantic, the sexuality is so important. Right. And the way it will look, sort of the end result, is going to vary from couple to couple, and that's not up to me.
And so you brought up a really good point, is that therapists and professionals working with the public who will run across this need to educate themselves about, again, certain things to do with sex, and have that comfortability talking about that. Mm-hmm. And so in order to do that, you've actually designed an entire workshop. Mm-hmm. So talk to us about your workshop.
Okay. So I do the workshop is really zooming in, on how we would use EFT, the same principles of, at the beginning, tracking the negative cycle, being able to see that couples can have two different cycles. The relational one might not be the same as the sexual one. It's not very unusual. So to be able to distinguish, because therapists can get quickly confused. They think, okay, the relational cycle, he's the pursuer and he's looking for this connection, and she's the withdrawer and she's trying to protect herself and feel safe. And then suddenly we talk about sex and it's all upside down. Right? You're like, wait, what happened? So now even when I think most of us trainers teach, we do address that sometimes couples can have more than one cycle, especially around sexuality. Mm-hmm. So we want to unpack that and how to bring in sort of pieces of psychoeducation into tracking the cycle, because we can start doing that pretty early on, and the decisions on when to do it and when to put it aside. Right, that's something we're going to explore. I do provide some basic core knowledge about models of sexuality, the desire. I joke that when people start talking to me about desire or attraction, I learn to treat it the same way I think about communications. Right, they come in and say, we have communication problem. That's just the beginning. I actually don't know at all what they mean. The same applies to desire, attraction, etc. So some other information about sexuality that is important to know and to keep in mind as you're working with couples. We will watch videos of me working with some couples who are struggling with different things, and also experiential exercises. We'll do some that focused on becoming aware of our own biases about sexuality, but also to practice how, for example, when one partner is so desperate and so sort of demanding and sometimes to a point where it feels forceful and non-consensual. That's something that can raise a lot of concerns for the therapist. How to connect with them, how to make sense of their desperation around sexuality. So that's one practice we're gonna do. And also on the other side, people who may be more inhibited and more threatened by sexuality, or years of negative sexual cycle and relational cycle left them feeling unsafe, insecure. And so they learn to not only push the partner away, but also turn off their own desires. I recently had a live session, a consultation session, and the couple was very courageous and brave to say, we know there's a bunch of people watching us, but this is so important. We want to deal with it. So they actually spoke about the erectile dysfunction and her shutting down her sexual desire, which immediately she burst into tears. So this will be one of the videos that I will be showing, and you'll see what happens in the end.
Oh, that sounds so exciting. So it sounds like, so your workshop is Sexuality and Stage 1 of EFT with highly escalated couples. And so what I think I hear you saying is that a lot of times couples, you know, will work through the relational cycle, but a lot of times they'll present with sexual issues, and that may have a cycle of its own. And sometimes the therapist can get lost or confused in trying to understand how the two intersect, or it might be different.
Mm-hmm.
So it may make it more challenging to treat it. So when we, you know, by attending your workshop, we'll be able to understand that, yes, it really can happen where there's two different cycles.
Mm-hmm. Absolutely.
The sexual behaviors, the beliefs, the emotions attached to their sexual ideas and pattern into the stage 1 cycle. And you'll show us some demonstrations of you've done, and maybe I like how you said we'll talk about our own biases. Can you maybe touch a little bit more on that and maybe talk about like maybe the biggest bias that you've seen from therapists as you've done this work?
That's a great question. The biggest bias I've seen.
Or the most common bias?
Most common one, right. I think there is oftentimes implicit idea that there's some type of norm, that what is normal sexual, whether it's frequency or the kind of sex people are having, they have some idea. It's often not necessarily in their awareness, but as they start talking about the case, it comes across, you know, there's something wrong with this.
Right. And that
right?
may lead to their work with the client, and then
that's right.
They feel like, oh my God, our therapist says we're not having sex enough, when really they might be deeply connected when they have sex, even if they only have sex once a month.
Exactly. Yeah, I will be using the work of Emily Nagoski, who is a best-selling author of this wonderful book, Come As You Are, on female sexuality, that I think is good for men and women. And Emily wrote the book after she was teaching female sexuality class at Smith College to very smart, young, sophisticated women. And at the end of the class, she asked for, you know, what's one thing you learned? And these brilliant women, most of them wrote, I learned that I'm normal, which is very sad, right? That they had so much doubt about being normal, that certain ways they have orgasm or their desires or fantasies may not be normal, right? So that's what made Emily write a book about sort of normalizing and making sense of what she calls our sexual inhibitors and accelerators, and be able to have conversations with our partners. Because there, you know, people come in and say, can you please help me have better sex with my wife? You know, what should I do to please her, right? And so my job is to say, well, you know, she's the one that has the best answers. So let's talk about it together, right?
Yeah.
I hope I answered your question.
Yeah, and that's super interesting, because I find, you know, just like in the relational cycle, sometimes couples feel like they're sending clear signals, And that comes across in the bedroom too. I feel like I'm sending clear signals that I'm aroused, or that, I'm really enjoying this, or that I really find my spouse beautiful. And the spouse just completely misses that.
That's right.
Head, and then we have a missed cue, and then, they fall into escalation.
That's right. That's right. So I'm glad you brought it up, because if we think about what is our goal for EFT, right, at the end of the treatment, we're hoping that the partners will be more accessible, responsive, and engaged emotionally, right, with each other. And that includes attunement. So what is sex? As Sue says, sex is a dance. It's an emotional dance with our bodies. And so if we are not attuned, if we are in some kind of, concern and have worries about our own performance, and we're not quite tuning in into our partner's cues, or we're not relaxing enough to actually pay attention to my own body and my own arousal and my own pleasure, then how can this dance feel good?
Yeah, and that's so important that you said that. I often hear from a lot of couples where, one person may be the pursuer in the regular relationship cycle, but they also suffer from self-esteem issues, and that makes them start to tune out of their own bodily cues that
That's
they
right.
want to have sex. And
that's right.
You ask them, well, how often do you initiate? Or, and they're like, never. And you ask them, well, are you even aware in your own body, like, that you want to have sex? Do you randomly get that urge and you want to, and they're like, no, I've shut it off a long time ago.
Right.
A lot of times it comes from view of self. I'm not good enough. I'm not attractive enough. How could my spouse want me? Or oftentimes, missed cues. I've reached for my partner so many times and they've shut me off and shut me down, rejected me. And what's the point if I'm just going to get rejected? And that hurts. So I just shut it down and tune it out.
Exactly.
And if I don't have the need for sex, then I don't ever have to be rejected.
Right. That's right. That's right.
Yeah. So it sounds like the workshop is going to be so exciting and such a vital part of our training as an EFT therapist, a really core piece that we could use some extra information. So you teach this workshop a lot in New York, right? And you teach it outside of the country. But for this,
right. I have done this in Russia, and we're about to have a big conference in Rome where I will be presenting.
Wow, that's so exciting.
Yeah.
First time ever, we're going to get you out here to Las Vegas, to our side of the country, and you're going to do your workshop here. It's going to be held at UNLV here in Las Vegas this summer. So if you guys are interested, you can go to the Try EFT workshop or website and sign up. Now, if folks are in other parts of the country and they can't catch the Las Vegas workshop, how can they keep a track of where you're going to be offering this workshop?
That's a good question. Well, I don't have an answer to that. Because I do have a website. It's cpidnyc.com. That's my center for my work here in New York. It's cpidnyc.com. That's where we post this what we call Sex Therapy in the City series. We're now in our second year when we bring speakers. So it's probably a good idea for me to have a page with my upcoming workshops if they're elsewhere. I know there will be one in Philadelphia in March 2018. That's the next one for sure, and maybe others. I think a lot of what we will be doing, it's still very, very focused on EFT, like really honing in your skills. But I think it's another area like sexuality, addictions, affairs, that it does help to have a little extra knowledge and tools in your toolbox, just to feel more comfortable, because the more comfortable we are, the more grounded we are in the room, the better EFT will do. And also know when it's time to refer out and get some extra help or extra consultation. I'm hoping, I'll cover some other pieces about, sexuality and aging and out of control sexual behaviors, those elements, how to nuances of working with that.
Right. Okay, super. So it sounds like if folks want to follow you on your website, which I'll post here in the video, then maybe they can sort of keep tabs on where you're going to be and what workshops you're going to be offering. And if you guys all want to go to Rome, catch Zoya.
That's right.
Super jealous. Would love to go see you in Rome. I just want to go to Rome.
Oh, I know. And this is going to be amazing with Sue and Emily Nagoski and Ian Kerner, who will be featured in one of my videos as well, because I like to collaborate and learn from other people.
Excellent. And you guys don't miss the chance to see Zoya over here on the West Coast here in Las Vegas, Nevada. This summer, it's in June here in Las Vegas. Again, check out tryeft.org. You can sign up for her workshop. Don't miss it. Zoya is super awesome, and this is such an exciting opportunity to hear and work with her. And
and I have a special place in my heart for Las Vegas, because when I was trainer, I was there with Becca Jurgensen doing one of my first externships. So I'm really thrilled to come in and share my knowledge and also support your community. I'm really excited.
Well, and thank you so much for coming out to be with us and offer your workshop. And guys, just make sure that you follow Zoya. She's got her website. Also, she's part of the NYCEFT, the New York Center for Emotionally Focused Therapy. And of course, our mothership, iceft.com.
That's right.
Find more information about trainings and workshops. So thank you again so much, Zoya.
You're so welcome.
And guys, just make sure that you check up on her and where she's going to be and check out her workshops. Thank you, everyone, for tuning in to We Heart Therapy. Make sure that you hit subscribe, because more episodes are on the way.